Thank you very much for having me, and it's been a pleasure to get to know Uli and the SOAP organization here, and I'm very happy to be here and present tonight. So I serve as the Chief Medical Officer of ConnectWell, as Uli said, a public-private partnership with the UC Berkeley School of Public Health, and ConnectWell is a leading-edge provider of health and wellness content that's academically sourced, expertly vetted, up to date, and geared towards a consumer audience. So essentially the patients, so that they can understand and read and not be confused by medical information. And this slide just illustrates our public-private partnership, which is a very unique type of relationship with any private entity in a school such as Berkeley. So I'm very proud of that relationship. So I'm going to start by just telling you a little story about a patient of mine. And as Uli said, I did practice HIV medicine in Africa. And this is one of my patients. I'm going to call her Victoria for purposes of anonymity, but she's a 24-year-old woman from Nigeria who I had been caring for in the clinic. She's HIV positive and pregnant. And she came to me for was referred here by high-risk OBGYN to start antiviral therapy to prevent mother-to-child transmission of HIV. And we talked. I started her on antiviral therapy. She responded well. Her HIV viral load became undetectable, thereby reducing her transmission rate to almost zero. And I was very excited about her results. I shared them with her. And she came back about 3 or 4 months later for her next appointment, and she had told me that she had stopped her antiviral therapy, that she had read an article on the internet that said that pregnant women shouldn't be taking medication because it could harm the baby, cause fetal abnormalities. And after I caught my breath and I thought, oh my goodness, how did I go wrong? Where did this mistranslation occur? I understood that, technically she was right. Pregnant women should not be taking medication. But I had explained to her that, what we were trying to do was prevent illness and prevent this problem. And somehow there was a disconnect. And she had read something on the internet that she had taken out of context that in and of itself was correct but wasn't pertinent to her particular case. And she made a decision that could cost the life of her baby. And it was very upsetting. And this gets to the heart of the topic that I'm going to be talking about is, where you get your healthcare information and how do you know that it's, correct and that you can trust it. So not so long ago, the only source of healthcare information that anyone had came from the physician. He was able to, or she was able to give information to the patient in this one or unidirectional mode, and the patient was just pretty much asked to accept it as it was. There was no place for the patient to go and research their therapies, and you just took it at face value. And this represents what we call the principal agent issue in medicine. The principal being the physician who has all the knowledge and the power, speaking to the agent, which is the patient, and somebody who just ends up accepting what that person had to say. So there's a real imbalance, if you will, in knowledge and in power. So with the invention of the internet and the fact that many people started being able to search online for health information, we've all become a Dr. Google, if you will. We put in our symptoms, our complaints, our diseases that we may have been diagnosed with, and then we read all about them. And sometimes we get very nervous. We can cause ourselves a lot of anxiety, hear about this, so it can be a two-edged sword. But we can end up misunderstanding this information. We can take it out of context. Many of the things that we read on or online are complicated by advertisements. Somehow everything ends up being directed to a advertisement for Humira, and that's what you're supposed to be taking for everything. The number one biologic here in the world. So you can end up having seriously negative health outcomes if you interpret this information incorrectly, just like what happened to my patient Victoria. So many Americans live with chronic health disease, and it's no wonder we all look up medical information all the time. And these chronic medical conditions, lead to patients wanting to know more about their illnesses. And according to the CDC, 70% of chronic illnesses and their associated costs are related to unhealthy lifestyle practices. 60% of Americans live with at least one chronic illness, and 42% live with two or more chronic illnesses. And when you have a chronic illness, that requires the patient to be heavily involved in the healthcare system. They become very dependent upon it, and so they're looking up information all the time. And many of these, as I mentioned to you, are lifestyle issues. They include obesity, diabetes, hypertension, hypercholesterolemia, many of these things that can be prevented. This slide shows the 7 most common and expensive diseases that we take care of here in the United States, beginning with diabetes, Alzheimer's disease, heart disease and stroke, cancer, obesity, arthritis, and pregnancy and postpartum care. Pregnancy and postpartum care, as you've been an OB anesthesiologist, that's an expensive time in one's life. It's not a disorder, it's not an illness, but it's an expensive time in one's life, and mistakes can cost a lot of money if you don't anticipate and prevent problems along the way. We have spent last year $3.65 trillion in healthcare in the United States. And the U.S. ranks number 27 in the world for healthcare and education according to the Institute of Health Metrics and Evaluation. And that's down from the 6th place in 1990. Despite this large spending, the U.S. does not have better outcomes for basic things like infant mortality and the adult lifespan. So take a look at this slide. It's a very busy slide, but all of these sites represent places where you can obtain healthcare information. You are being bombarded by it, right? In the grocery line, online, on TV, in magazines, in journals. All of these places are people and places that are trying to feed you information about your health, get you to buy something. And they go on and on. Some of them are very reputable, some are a little sketchy. And sometimes most people who aren't in healthcare, I'm preaching to the choir here at the medical association, but most people don't know dink about any of this, right? And they just read it and they think, oh, this is important for me. So the problem is that when you read these things, the potential for influence on one's life is very great. So the risk of misinformation and misdiagnosis on the internet is a real concern. And you can look for all sorts of problems, put in your symptoms, and end up with a lot of anxiety, and we call this cyberchondria. So the unfounded escalation of common symptoms based on search results and online literature. It is a real thing. You all know I'm talking about it. I mean, how many people practice medicine and somebody's called in or come in and said that, they've read something, they think that they have this weird zebra disease, and you have to spend half of your visit or more trying to talk them out of it. And I just said to somebody last week in my clinic, I promise you you don't have Lyme disease. And I swear to God, this is, it's a real issue here. So, so what can be done to help this individual patient? How do you assess whether you're getting accurate information from a credible source that is non-biased? And this is one of the main topics that I'm going to be speaking about here today. So where you get your health information really matters, okay? So seeking out trusted sites is one of the first things to ensure that you're getting accurate information. And these are what many professionals would say would be trusted sites for you to access, okay? They include the National Library of Medicine, which is the NIH, and Medline Plus, and there's the websites of those. Also, people want to participate in clinical trials, or they're looking for therapies that may help them if they have a particular disease that may not be treated by standard therapies. So clinicaltrials.gov is an excellent place to go and look for those therapies. The CDC, Centers for Disease Control and Prevention, has a number of great reputable sites, specifically Travelers Health, Very important. That's a really important site that if you're traveling and you want to know what vaccines you may need, what prophylaxis you may be taking, what you should be watching for when traveling, this is a great place to go. And if you go to any travel clinic, they'll send you to this place anyway. Office of Disease Prevention and Health Promotion is a very important site as well. The U.S. Preventative Services Task Force, also known as the USPSTF, is another one. Your state and local health departments, organizations like the American Diabetes Association, American Heart Association, American Cancer Society. Leading universities and medical schools are also great places for accurate information. And then a source like UpToDate, which is an online resource for physicians. Again, many of the articles that you read on there are geared towards the professional, not for a patient. They are quite detailed, esoteric. They've come up, with all the newest and latest therapies, and they're dated, but they're written by many academicians and not for the lay patient. And then medical societies like the American Academy of Pediatrics and many others are all places where I and others would recommend that you can get trusted health information. But you have to look on the web, and looking on the web can be dangerous as well. It's an open source process. So what are some of the things that go along with standard trusted information? Well, first and foremost, FDA-approved treatments, medications, and devices. These have all been supported by rigorous clinical trials. Evidence-based information that is backed by clinical trials. Certainly the gold standard are randomized and placebo-controlled studies that are the gold standard. Other types of studies are also useful, retrospective. But when a patient goes on and looks at, should I be taking chondroitin? They don't know to look for a study. They don't know what a randomized placebo-controlled study is. I mean, was it big? Was it randomized? Was it, valid? It's hard to know. And then expert recommendations from respected organizations. Sometimes when we don't have clinical trials to support what we do, we look to experts to support what it is that we are doing. So what are the things that we need to be cautious about when looking for information and when you're looking online for healthcare information specifically? Well, you need to look for sites that have sponsored advertisements. Sites that look fake are fake, okay? So you should not, and again, I'm preaching to the audience here, but patients should be made aware of that. Any site that requires payment in order to get more information, definitely be aware of. Sites that promote quick cures, sites that offer miraculous, instant, or guaranteed outcomes, sites that offer fast weight loss, and then old and undated articles, especially for topics that have rapidly changing therapies like cancer therapies. You should definitely look that when this article was written and by whom. So I'm going to show us, this group here, a little common online search sample. And we're going to go to Google. We're going to be all Dr. Google for a second, and I'm going to type in back pain, and I'm going to show you some of the things that are going to come up with back pain. But there's a couple of things that I wanted you to be aware of. When you do an online search and you find the information here that comes up in one of the search sites, you'll find two things: sponsored items, which are advertisements, and then organic items, which are derived from the search engine algorithm itself. And thankfully, Google will give you a little green box ahead of it to let you know that it's an ad, but sometimes it's hard to know the difference. And then a couple other things that you should know is that studies confirm that when a user clicks on a particular article, 32% will click on the first result, okay? 17% will click on the second result. By the time you get down to the seventh result, only 3.5% of users will click on that article. So there's a drop-off that happens pretty quickly, and the average user won't go past the first 5 listings. And that's important to know, because what if those first 5 listings are bogus? And how you end up on a Google search has a lot to do with several things. The frequency and locations of keywords within the website. So if the keyword only appears once within the body of the page, it will receive a low score for that keyword. how long the page has existed. So people create new web pages every day, and not all of them stick around for a long period of time. Google places more value on pages with an established history. And then finally, the number of other web pages that link to the page in question. So Google looks at how many pages link back to that site to determine its relevance. So those are all things that will factor in what comes up on a Google search. So let me now go to Google, and we're going to type in back pain. How many hits do you think I'm going to get by typing in back pain? Anyone have an idea? How many? 2 million. 2 million? 3 million? 83 million?
1 trillion.
1 trillion. You're closer. 1.32 billion hits were generated in 0.64 seconds, all right? And first site here is WebMD. And many of the things that, that come up on this search will depend upon a variety of things. First of all, where your location is and what your search history has been in the past. We're over here in Oakland right now, but a lot of that is going to determine some of the ads we're going to see are geared towards this area. But I live in Palo Alto, so if I had the computer and I was doing this in Palo Alto, I might get a lot of sites with Stanford or something much different. So let's take a look here. So we're seeing something for WebMD, the Mayo Clinic. Actually, here's now something from the NIH. So I told you that was one of the sites that you can trust. eMedicine Health, Medicine Net, I don't know that. Oh, here's some ads or locations where you might get treated for back pain. Backcountry Chiropractic and Wellness Center in Idaho. Oh my goodness, so somebody's computer's been in Idaho. Where have you been, Uli? All right. Oh, okay, so Medline Plus, that was something that I showed here to you. So here's some videos. And then again, smartphones linked to bizarre home-like skull bumps. Now, why that would have anything to do with back pain, I don't know, unless you got hit in the rump by that rhinoceros there, but that may cause it. And then you see some more things here down at the end. But let me actually just click on something, the first thing that came up. I'm going to just hit WebMD. All right, so this is what's come up here on WebMD. I am seeing a bunch of flashing things here. Looks like Las Vegas. Oh, a sign, something can be a sign of ankylosing spondylitis. Maybe that's my back pain. Here, I need to take the quiz. And there's an ad at the top and over here at the side, and I have pictures that are flashing and changing quite interestingly and quickly, and then latest news and features and more videos. What's going on with this guy over here? He's looking at me. I don't know. Oh, maybe he has it. Dan Reynolds. Oh, take the quiz. Look at that little animal. Oh, so here's some WebMD blogs and managing my pain. Oh, there's some WebMD community. Where's the stuff about back pain? Oh, here it is at the bottom. So I'm going to click on read this article. And now I got some more stuff here. Is it sciatica? Oh, another ad. Understanding back pain symptoms. What you're seeing me go through here is getting really confused by all the different things that are coming up. All right? The fact that I have ads flashing at me. I have things that were not even related to what I was looking for in back pain. I got questions about ankylosing spondylitis. I have WebMD asking me to put their app on my phone, and I kind of forgot why I even came here to begin with. That's one of the problems with searching for something like this on a site with a lot of ads and something that's supported by advertising. So again, I'm being looked, I'm being potentially geared towards some biologic and thinking that maybe I have rheumatoid arthritis. So that's a bit of an issue here. So, so what can we do about this? What is simpler? And that's what I'm going to talk to you here about my work with ConnectWell and what my colleagues and I have been doing with the School of Public Health. So ConnectWell is a public-private partnership with UC Berkeley School of Public Health. UC Berkeley has been a pioneer in wellness education for over 35 years. They produce science-based, expertly vetted current information, a lot of in-depth information with a wide-ranging coverage of health conditions and wellness practices, with short and easy-to-read articles for optimal learning. And the entire program that they have is divided into 3 parts. A health and wellness digital library, which includes health conditions and disease states. And then once you have a particular illness or you want to live healthier, they advocate and teach you about wellness initiatives to take the next step to empower yourself to do a better job. And this includes healthy eating, staying active, better sleep, managing stress, healthy travel, and maternal health. And then the third component is nutrition and eating whole foods and preparing foods in a healthy way. Not far from here, Berkeley was actually ground zero for the farm-to-table movement, as you know, eating foods in a sustainable fashion, things that are, or sustainable manner, things that are in season and eating organically when possible, and healthy, simple recipes. And so this is the full component of the health system here of ConnectWell. So it's one trusted and expertly vetted site, simple to search and access information. I'm going to show you that in a moment. There's a wide range of common health and wellness topics, no distracting or misleading ads. It's a holistic approach to well-being, and I'm going to show you a little demonstration here right now. So I'm now into the ConnectWell Wellness Library. And as I mentioned to you, it has 3 components: the Health and Wellness Library, Wellness Initiatives, and the Healthy Recipe Collection. Wellness Library has a Google-type search bar that you can type in any keyword you want, or you can search by any of these icons here, familiar. So I started with back pain on Google. We went to a WebMD site, and I'm going to show you here what back pain on the ConnectWell site looks like. So clicked on back pain, 45 articles come up, and it starts with the most simple, easy to understand article on the anatomy of back pain, what it is, and then it gets slightly more complex through time. But it's a sequential learning process. So I'm going to click on the article. We have the Berkeley Public Health logo that comes up here and explains to you what the anatomy of back pain is, where things can start. Very easy reading. A lot of everything is geared towards the 6th to 9th grade reading level, so it has an appeal for everybody. If somebody's coming in and needs to read something, you can simultaneously give it to somebody with a lower education versus somebody who may be the CEO of a company coming in. And a lot of bullet points, easy to read. And then once you've read the article, then you can actually then read the next sequential article. What are the causes of back pain? And again, going down, you can see the kind of an interesting photo, gets people interested in, and then you'll read the next component. And then related wellness initiatives. So I've told you, once you have something, and what can you do about living a better life and more healthy life. So we're going to look up posture and musculoskeletal health. That's what comes along. And you can print this out, and then now you see some articles about healthy posture, the impacts of forward head posture, shoulder rolls, things that you can do here for that. So I can go back to the previous article, or I can go back to the home page and print it out. Wellness initiatives, as I mentioned here, there are 6 of them, but we do have an excellent maternal health program here, preparing for pregnancy, wellness during pregnancy, and thriving postpartum. Again, planning all this out for pregnancy. And then healthy recipe collection here, as I mentioned as well, which has a number of healthy recipes based upon whole nutrition. So I'm going to go back here and just finish up much different experience in going through there. No advertisements, simple, easy to understand, engaging photos, and a single site where you can get good trusted information. I'm going to just finish up here with my patient's baby. Thankfully, she resumed antiretroviral therapy. Her viral load was undetectable again. The baby was born HIV negative and has remained so with additional testing. Who do we serve at ConnectWell, and who are our customers? So we provide healthcare content and all of this information to healthcare providers, health systems and health plans, telemedicine and health device companies, anyone who's looking to provide content, health coaching companies and wellness engagement platforms, employers and benefit providers, any company that needs medical content. It's very easy to integrate. It's a seamless redirect to the ConnectWell site. You can incorporate the ConnectWell API for enhanced user experience. So we hope to be in Epic here in the not too distant future. Host ConnectWell content into your existing platform as well. And our revenue model is based upon an annual content license agreement with ConnectWell. And again, UC Berkeley is part of that model. So thank you very much. This is my contact information and the website, connectwell.health. And if you want additional information, you can type info@connectwell.health. And I'll open it up for any questions. So thank you. Yes? Yeah, so the question is, whose responsibility is it to educate the general public about health information? And there are many people and entities that this responsibility falls on. Certainly primary care physicians treating patients, health systems providing care. The government has a lot to do with that as well. In a democratic society, individuals are often responsible for their own education and development as well, but we want to make sure that they have good information. Employers often are responsible for their employees, because if employees are sick or not living a good, healthful life, it impacts the work environment and then increases the cost to the employer as well. So we find many employers wanting to make sure that their employees have good health information. So the responsibility is not just one entity, it's everyone. And then we find safety nets. That's why we have government programs and social services to make sure. But this is not a free system. You cannot go online. This takes a lot of people. We have over 100 people that are editors and reading and writing these things. And these come out of studies, and it's inexpensive. It takes a large village to put this together, believe you me. And but the goal of the university and ConnectWell is to make this available. And doing so in a digital fashion has brought the cost of this down tremendously. This all used to be available in published form. So you can actually go onto the Berkeley University website and buy a lot of this information, but it's going to cost you a lot of money. So scaling this all up in a digital format has made this, as I call, the democratization of healthcare information for everybody.
So
Gary.
Is all the content that's on the ConnectWell site scientific evidence-based content?
Yes, it is. It's all been reviewed by multiple sources. So if you go on and read something about diabetes, the diabetes chapter has been written by somebody at UCSF, who's the head of the clinical diabetes program there. It's a large white paper that's updated annually. That's our source content, and then additional medical writers will actually take that, write it at a level that the consumer can read and understand with engaging photos, and then ConnectWell comes in with its architectural magic and brings it all together in terms of our ability to search through all of this. It's a lot of work.
Are there references as well?
References at the end of every article, dates when it was written. The University of California Regents are actually the true owners of all of this. But any company, Kaiser could use this, for example, and you can erase the Berkeley masthead at the top. You can white label it, absolutely. So Stanford, who may have a rivalry with Berkeley, you can remove the Berkeley masthead again. Yes. Sure. So the question is, our revenue model, she mentioned the fact that we're doing business to business, but we don't do a business to consumer model only because of our licensing agreement with the university. There's other publishers here that have that direct to consumer model that they can, a consumer can order the white papers, and so that infringes upon the way that they do business. Yes, question. So that's part of the, being partnered with the University of California, Berkeley School of Public Health that's been doing this for 35 years. They've been a pioneer in this. And knowing that it's academically sourced, expertly vetted, all you can do is present that information, and the fact that everything has been evidence-based and based on clinical trials, and those references are listed. But that's the same type of quagmire that we have with vaccines. You can present somebody all the information you want, but if they choose to go la 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 la, you can't get into it, right? So we recognize that this is quality. Quality costs money. We make this available through reputable sources and businesses that want to invest in that for whoever they serve, all the different populations that they serve. Yeah, Gary. So that's a good question. Whom are we seeking funding for? So actually, my presentation tonight was not a pitch for any funding. This is a self-funded company with employee ownership and with a revenue model that benefits the School of Public Health. And so we are selling to people who want to invest in good quality information. And we feel that's the best way to do it. And there's no advertising here at all. Any other last questions? Thank you very much for your attention.